So one of the most common things I see in acute shoulder pain is kind of like the joint is shifted. A lot of the times it comes from repetitive movement, or you're doing something forcefully, or something that you don't normally do. Maybe you lifted a little heavy, or etc. So the joint can kind of shift a little bit forward. Now, when I say shift, I don't mean dislocate. It's not completely out of place. It's just more of a mechanical dysfunction. And that's where I come in, and I get to mobilize the joint and get it moving better, so that way you get your range of motion back to normal, and then you can get your strength back to normal as well. I have brought this up in some of the posture videos that your shoulder can be a little bit too forward, and that will not only affect your shoulder but also your neck, and it can cause other issues. Most of the time people kind of let this stuff go on for a while until it doesn't go away. So it may last a few weeks to a few months. Honestly, the faster you get it looked at, the better. But I'm also saying you don't need to be a hypochondriac. So a lot of the times that's the biggest thing. It can lead to impingement symptoms as well. You generally tend to keep pretty good motion and have good strength, but you'll have pain with certain motions. If there is rotator cuff tear or a rotator cuff involvement and it's pretty serious, that is where a loss of strength definitely is most seen. Your rotator cuff muscles play a really big role in not only stabilizing your shoulder, but also giving you range of motion and strength, right? And so a lot of times with rotator cuff tear, especially a full tear, you will not be able to lift your arm all the way, or there'll be a significant change in your strength and your ability to do that. More of a partial tear, you'll be able to still lift it. It's just going to be a little weaker, but if it's a full tear, you will not be able to lift your arm all the way, most likely, depending on the muscle that's torn.